Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Hi, I'm Colleen Bamford. Welcome to Health Watch, presented by UMass Memorial Healthcare. In the past several years, there have been major breakthroughs when it comes to gene sequencing and how it affects illnesses. In this episode, we take a look at gene sequencing and its effect on cancer treatment.
Most people think gene sequencing refers to a mutation they inherit from their mother or father. And that can be very important because using that information, we can prevent the cancer from ever occurring or catch it early enough to be curable. But that's not the major focus of our lab. Our major focus are the patients who actually have cancer. Our goal with gene sequencing is to identify the gene mutation which is causing the tumor to grow. With that information, we can make a diagnosis, tell the patient what kind of cancer they have. We can help an oncologist decide what treatment to use for the cancer. And sometimes we monitor the levels of a mutation to see if the patient is responding to cancer.
Oftentimes we hear about personalized medicine. What does this mean?
We know that no two cancers have exactly the same gene profile. And what does this mean for the oncologist? Well, he's going to take the results my team has generated, look at the gene mutation profile, and choose the best treatment for the patient. This might mean a magic bullet. By that, I mean a drug that targets a mutation specifically without the side effects that you usually experience with chemotherapy. This can also mean we identify a resistance mutation. In that case, the oncologist would choose a different therapy and avoid what could have been a very expensive drug that was destined to fail.
What type of cancers are being targeted?
We focus on all the major cancers and primarily those that have multiple treatment choices. This would include lung, colon, breast cancers, melanoma, and leukemias. We also have a research focus on pancreatic cancer. Funding from the Pancreatic Cancer Alliance, a local organization, allowed us to develop a new test for pancreatic cysts. Some of these cysts go on to become cancer, and they require surgery. Other cysts do not. The test information we provide allows our surgeon to make a decision about whether surgery should be performed or not.
How do patients benefit from gene sequencing? Can you walk me through an example?
I think lung cancer offers the best example. We've seen the biggest advances in lung cancer when it comes to treatment options. It's routine for our team to be asked to test up to 7 genes in lung cancer. And it's a rather complicated process. It starts with the oncologist who asks for the testing, and then a pathologist who reviews all the slides and picks the best block. Then a histotech cuts that block and sends it to our molecular tech, who dissects the tumor, extracts the DNA, uses this device to make a library, and this device to sequence the genes in that library. The testing is analyzed and create a report. The whole process takes about 7 days, and multiple people are involved. And one thing I would like to point out is that biopsies from lung cancers are very small and may contain very few tumor cells. If we used our old technology, the standard technology, we would have real problems. Sometimes we had to send the patient back to the operating room to get a second biopsy just to get enough tissue to do testing. That almost never happens now that we've adopted next generation sequencing. And that is a real benefit to the patient. But more than that, we are able to look at a 50 gene panel that includes all of the cancer mutations with FDA approved therapies. And when we do that, we offer patients and oncologists more choices. If we continue to use the standard method, we could only look at a few mutations, and we might miss infrequent mutations that would respond to a targeted therapy. And for example, we've had instances when we detect a particular mutation, and the oncologist can then send our patient to a clinical trial that targets that specific mutation, and they derive benefit from that. Okay, so let me provide an example of one of our patients. We used a molecular test to diagnose them with acute lymphoblastic leukemia. And by doing so, we identified a specific drug that would attack the cancer mutation. At the same time, the patient received a transplant, bone marrow transplant, and they went into remission for 4 years. But over that time, we continued to monitor the patient, and we saw the disease coming back. So we sequenced the gene, and we were able to tell the doctor, use this targeted therapy to treat the patient. The patient went back into remission for another year. We keep testing them. The disease came back. We sequenced again. And again, we're able to say, the new mutation is present, but we have a drug for that. And the patient is now on that drug and still alive today.
Is DNA sequencing a way to diagnose, treat, or both?
It's both. If a patient comes to us and we provide gene sequence data and there's a drug that matches the mutation, the doctor's going to use that drug. And I call them the magic bullet drugs. They're the drugs that target the cancer specifically. They leave the normal cells alone, so you don't have the same side effects you would with chemo. If we don't find one of those mutations, then the doctor's likely to take the patient to surgery and chemo and radiation, the standard methods. But the patient has the advantage of both choices. If the patient fails the magic bullet therapy, some patients develop resistance, they still have the choice of going to the standard chemotherapy, radiation, and surgery for treatment. And this extends life and sometimes cures patients as well.
If someone has a cancer diagnosis, who would they talk to in order to see if gene sequencing is appropriate for them?
A patient should always talk with their oncologist. The oncologist knows them best, and they know what the treatment options are available to them. If testing is appropriate, the oncologist would contact the laboratory and we would proceed.
Does insurance cover this testing?
It depends on your insurance company, but for the most part, the answer is yes, insurance will cover it. Insurers already recognize the value of what is called a companion diagnostic to decide if a cancer therapy is appropriate for a patient. What we're doing here is testing the same gene mutations and billing for the same gene mutations we would have using a standard test. And so therefore, we expect insurance companies should pay for the test.